Hello, I'm Julie Tupler, creator of the Tupler Technique, and this week I'm going to talk about scar mobilization. This is very important when we're working on closing our diastasis, because if you have a scar, there's a stuckness there, and if there's a stuckness there, it's going to be hard for the connective tissue to remodel. When you get cut, what happens is in the formation of the scar, the layers of tissue adhere together, and it's an adhesion. So when you have that, when the layers of tissue are stuck, the stuckness causes pain, and it's going to be difficult, as I said, to close the diastasis. So the goal is, with scar mobilization, to unstick the layers of tissue that are stuck together with the scar. All right? That's really important to help close the diastasis. So with scar mobilization, there's 3 things that you can do. Now, you want to start scar mobilization when the scar is healed. You might not want to touch the scar because it's numb and you're just queasy about it. And that's okay, you don't have to mobilize it, but it usually takes between 6 and 8 weeks. You really want to make sure that that scar is healed. If you don't want to mobilize it with your hands, and what I mean when I say mobilize it with your hands, so if this is my scar, mobilizing it means getting underneath it and getting it unstuck from the layers of tissue underneath. They're supposed to move freely. So that's what you're doing. You want to go this way, you want to get underneath it, you want to stretch it on each side, all right? So really freeing it up from being stuck from the other layers of tissue, because there's a stuckness, as I said. So that's the one thing that you can do. And I've, on the Tupler tips, I have a wonderful article by a physical therapist, and I go into more detail on the scar mobilization, so please do read that. The second way is with the taping. You can use a kinesio tape, you can use my tape, and basically just putting that on the scar. Now, what happens with that is that when you pull the tape, it wants to recoil to its original unstretched position. So when you put that on your C-section scar, when you take it and put it on the stretch it and put it on the C-section scar, what happens, it's going to move this way, and that recoiling is going to be pulling or stretching on that scar. When you use it on the belly, it's a communication between the skin, the muscles, and the connective tissue, that they're moving in this direction. And that's what we're doing with our splint, and when we double splint is approximating and teaching the body that this is where we want the muscles and the connective tissue to be. So so what it's doing with the C-section scar, it's like pulling on the scar, and that's good. It's because that's what, with scar mobilization, you're wanting to stretch it and pull it and get it unstuck from the layers underneath. The third thing that you can do, there's physical therapists that have laser, and then there's this Dolphin Machine, which is a microcurrent, and it's these little machines, and I have a picture up in the article. And basically, this uses electric current on each side of the scar to mobilize it, and the research on this is fabulous. I'm recording this in June of 2018, and I am taking a course on scar mobilization the end of this month, so I probably will be talking more about this maybe in one of the webinars. But this is something that that therapists can use, and they told me that sometimes people can just mobilize their own scar with this also. If you want more information, I'm certainly glad to give you more information as soon as I take the course. Anyway, so those are the 3 ways that you can mobilize the scar. But just remember that this is very important in closing your diastasis. so that there's more movement of the connective tissue and no stuckness. Okay, thanks.